My name is Joy Jessup. I'm a student with the Winston-Salem State RN to BSN program. Today, my husband Thomas is going to assist me in performing a neurological exam. Thomas, do you give permission to be videotaped and to use this for educational purposes?
I do.
All right. We'll start out with a little bit of history. I want to ask you some questions as far as any neurological history that you may have experienced in the past or recently. First, we'll start off. Have you had any history of headaches?
Occasionally.
Okay. Are those frequent, or just kind of scattered out?
Kind of scattered out.
Okay. How severe would you say those are?
Probably about a 2 or 3.
Okay. Have you noticed that they're associated with anything, any particular?
Certain times of year.
Kind of seasonal?
Kind of seasonal.
Okay. Have you ever had any head injuries?
None.
All right. What about any complaints of dizziness, feeling lightheaded, faint, or even vertigo? That's where the room is spinning, or you're spinning and the room is not.
And sometimes when I stretch, I would get lightheaded, or when I was a child, I used to honestly have periods where I feel like I was going to blackout, but it'd be more of a whiteout. The blackout, because everything would go white.
Okay, and that happened more during childhood?
Early teen years.
Okay. Usually it was in relation to changing position or particular activity?
Moving, yeah.
Okay. Have you ever had any seizures?
None, but I have passed out from heat exhaustion before.
Okay. Any tremors, any shaking of the hands, face?
I have had eye tremors every now and then, as well as I have noticed I have a finger tremor. I think that was past job related, was stress related.
Okay. The tremors with the eyes, the eye twitching, does it worsen with anxiety or with certain activity, such as reading?
Anxiety.
Anxiety. Okay. Does it affect any of your daily activities when that begins?
When I'm reading sometimes.
I can see how it would. Okay. Have you experienced any weakness, either generalized or localized, or maybe with any particular movements?
Arms, right arm, elbow area, I have.
Okay.
And right leg, calf area, but that's due to a past injury.
Okay. As far as the right arm weakness, do you know that that's related to any particular activity?
I do not really, it feels like tennis elbow, but it's more generalized to the actual end of the elbow area.
Okay. Have you had any difficulty with unsteady balance, any falls, any clumsy movements, or maybe your legs give way while you're walking suddenly?
Yeah, knees occasionally, but that's due to past physical activities.
Okay. Any numbness or tingling, like the pins and needles in any of your extremities?
None.
Okay. Ever had any difficulty swallowing?
Well, this one time I got choked on a piece of chicken, but that's about it. But I've noticed when I first get up in the mornings, my throat feels like it's actually tighter than any other time of day.
Okay. Have you ever noticed that you had any excessive saliva or drooling aside when you're asleep?
Not really.
Okay. Ever had any difficulty forming words, speaking, or difficulty saying what you intend to say?
Not that I know.
Okay. Any other past history as far as neurological system? Strokes, spinal cord injuries, meningitis, any congenital defects, any alcoholism?
None of the above.
And our last history question here, are you exposed to any occupational or environmental hazards, like insecticides, organic solvents?
None. My past job I was the.
Okay. Have you been taking any medications?
Tylenol for a cold.
Okay. Do you consume alcohol, and if so, how often and how much?
Every now and then, maybe a glass a week of wine or something.
Okay. Any other drug use, marijuana, cocaine, any tranquilizers?
None of the above, definitely.
Okay.
And I'll avoid medicines if I can help it.
Okay. Well, now we get to the physical part of our assessment.
Okay.
All right, I'll give you the instructions,
Excuse me.
and hopefully this should go quickly and simply. First, I'd like you to close your eyes for me.
Okay.
I'm going to ask you to identify a smell. Then I'll ask you to close one side of your nose, and then we'll do the other to see if there's any discrepancies in the ability to smell what I'm presenting. All
Okay.
right? So now, deep breath, take a whiff of that. All right? Can you identify?
Kind of an apple cinnamon smell.
All right. Now, close your right side of your nose. Let's see. All right. Now close the left side of your nose. Take a smell. Is there any unevenness? You can open your eyes.
My right side actually smelled better than it did my left side. But as far as my size goes, my right side is usually my clogged up side.
Okay.
Have a deviated septum.
Okay. All right. The optic nerve exam will be excluded due to lack of the proper equipment to do so at this time. The optic disc would be visualized for size, color, and shape. Now we're going to check your pupils. Let's see, if you look at me, they are equal, round. If you'll look straight across. They're reactive to light. All right, I'm going to get you to look straight at the wall, and now look at my finger. All right, looks good. Okay. I'm going to ask you to look up without moving your head, just your eyes. And now look down to your left, to your right. All right, now look up here. Here, here, and good. All right. Next in line, we're going to check your trigeminal nerve. I'd like you to clench your jaw for me. All right, clench it real tight. Good. Now don't let me put it on your chin. All right. Now with your eyes closed, when you feel me touch you, I want you to say now.
No.
Okay, you can open your eyes. We could check the corneal reflex, but we're going to defer that for your comfort. I know you're really touchy about people being near your eyes. All right. I'm going to ask you to do a series of facial movements. Smile for me. All right. Frown. Close your eyes really tightly, squint them together. Lift your eyebrows. Show your teeth. All right, puff your cheeks out. All right. Going to stand behind you. I'd like you to close one ear off with your finger.
Okay.
And I'm going to whisper 3 numbers to you. And I'd like you to repeat those numbers back.
All right.
So first I'll get you to close your left ear.
1, 3, and 7.
Okay, now let's do your right ear closed.
9, 2, 4.
Wonderful. All right. Now, I'm going to get you to open your mouth. Just going to use your tongue blade. Going to check and see the structures in the back of your mouth. And I'm going to check your gag reflex. I apologize, it's uncomfortable, but we need to make sure that you have that reflex present. Okay? Open for me. Good. Sorry. All right. Now, I want you to try and rotate your head against force. So go to your right. All right, to your left. All right, gonna put my hands on your shoulders and shrug, and when I'm gonna push down. Good. All right. Now stick your tongue out for me. Good, everything looks nice and even. I want you to say the words light, tight, and dynamite.
Light, tight, dynamite.
Well, that's the end of the cranial nerve section. Now, I want you to relax. I'm going to move your joints. There's some range of motion. You just stay limp. You don't have to do anything. No lifting or anything. Okay. Let's see. To the other side. Okay. Also going to check your legs. You can relax.
Sticking to the chair.
Now, what I'd like you to do, I'm going to push against your forehead, you push against the resistance, okay? Push forward, and push back. Now, to the side, and again. Okay, arms up. When you push down, you push it. Again. Okay, now down. Cool. You're strong. Now out. And in. Good. Push up against my hands with your knee. Can you pull those up? Okay. Now the other side. Alright. Push down. Pull up. Down. And up. Okay. Pull your knees out. And in. Alright. Now, what I'd like you to do, I'm going to get you to stand and just walk at your regular pace to the couch and back to the chair. Just how you normally would walk. Okay, now I'm going to get you to turn and walk towards the couch again, except this time I want you to do heel to toe in a straight line. All right, that's good. All right, we'll come back over here. We're going to have what we do, what we call the Romberg test. Basically, I want you to stand with your feet together and your arms at your sides. Close your eyes. I'm going to hold that for 20 seconds to see if you have any balance issues.
Get my balance first.
All right, that's good. since you do have a history of a leg injury, we're going to omit the shallow knee bend and the hopping in place. You were able to rise from a chair without using armrest or any assistance, so that does give us an indication that you're doing just fine in that area. Now we're going to have a little bit of a test. What I'd like you to do is a knee pad. You put your hands on your knees, raise them up, flip them over. And now back. Now do that. There you go. No. All right. I'd like you to touch your finger to your nose and then touch your finger to my finger. Do that several times. Good. Okay. Now I'd like you to do what we all see in DUIs. I'd like you to put your arms out, fingertips to your nose. Okay? All right, good. The next one is heel to the shin. You're going to take your heel and rub it up and down against your shin. Do one leg and then the other. Okay. Wonderful. All right, now we're going to test your senses. I'd like you to close your eyes. When you feel sharp, say sharp. If you feel dull, say dull. Okay?
Sharp. Dull. Sharp. Dull. Sharp. Felt dull. Sharp.
There you go. Now, with your eyes closed, tell me where I'm touching you.
Toe, off big toe. Shin, right. Left arm. Right hand.
Okay. Now, keeping your eyes closed, I'm going to move your finger either up or down. You tell me which way I'm moving it.
Up. Down. Down. Up.
Okay? I'm also going to do this for your toes.
Up. Up.
Okay. All right. Keeping your eyes closed, I'm going to hand you an object that I'd like you to tell me what this object is.
Pencil, about 8 inches long.
Good job. One more thing with your eyes closed. You hold out your hand. I'm going to trace a number on the palm of your hand. Please tell me if you can identify this number.
7.
Yes, correct. I also would like you to tell me, I'm going to touch in 2 points. I want you to tell me when you only feel 1 point.
Eyes closed.
Eyes closed, please.
Right.
Okay, good. With your eyes closed, almost done with the eyes closed. With your eyes closed, I'm going to touch you. Then I want you to touch the same spot I do. your reflexes. Hopefully they're not brisk enough to kick me.
Only did that once.
You rest your arm. Your arm's a lot bigger than mine.
Is that what your thumb?
Mhm. One more on this side. Hold here. And now we're going to do this side. There you go. See if I can do this without dropping anything. Just relax your arm on the put your arm up your side. Really test you. Just relax. To this side. Alright. Now, I'm going to move your foot a little. Relax. Just let me move it. Alright, everything looks good. There are a couple of other reflexes that we could test, cutaneous and cremasteric. However, because of the clothing requirement of our video, we will pass those for now. One more thing I need to do. One more reflex, and then we're done. Okay. Sorry, I know you're ticklish. Perfect. Toes went down, foot turned inward.